So today I'm going to be doing a central line dressing change. So first, before you get started, you want to make sure that you introduce yourself to the patient. So hi, my name is Autumn. I'm going to be your student nurse today. And then you want to get two patient identifiers. So can you say your name and date of birth? Awesome. So you want to make sure those match. And then for this procedure specifically, you want to wear a mask as a nurse. And then you also want to make sure that your patient is wearing a mask as well. So then we're going to wash our hands and apply our regular gloves. Okay, and before we get to taking anything off, we want to make sure that we secure the tubing so that we don't dislodge anything during the procedure. Then we're going to take our chlorhexidine wipes and we're going to just use that to kind of ease the peeling of this dressing so that it will come off easier. So then once we get that off, we want to make sure that we take the stat lock off and then discard of that as well. And we will remove these old gloves, and then we want to wash our hands again. So after we wash our hands and we're ready to get into our sterile kit, so we're going to open up our sterile kit and then make sure that we have our disc with us as well. And then we are going to go ahead and open up our sterile gloves. Okay, so once we have our sterile gloves on, we're going to go ahead and open up our sterile field, get a little bit better. Okay, so then we're going to take our ChloraPrep and then, or whatever kind of cleaning you have in your kit, and you want to start with the insertion site and go forward and backwards, and then make sure you clean all of the tubing and all of that really well, and then you're going to discard of that. And then we're going to place our new little blue disc at the insertion site in the lumen right there. Okay, and then we want to apply our new stat lock. Okay, and then we're also going to take some skin protectant and apply that before we put on our new transparent dressing, just so that it won't pull or irritate the skin whenever they remove it the next time. And then with our new dressing, we want to make sure that we just put it with the transparent side down so that way they can see it. And then you want to date, time, and initial that. And then we want to clamp all IV access lumens and needleless connections and then swab caps. And then we want to clean those with chlorhexidine for 30 seconds and then let them dry. Also, I forgot to say that when we were cleaning around the first time that you want to let that dry for 2 minutes and not air it out or anything like that to get any bacteria on that. So going back to when you clamp all the IV accesses and stuff, and then you want to make sure those dry for 30 seconds, and then you want to reapply all those connections and caps. And then you want to also make sure that your patient is aware that they will be getting a 4% chlorhexidine bath every day. And then you want to go ahead and discard of all of your supplies and document. Thank you.